This is Health 54 right here on your digital-first Pan-African News Network, TOS Television. I am Rose Audu. A deadly fungal infection known as mucormycosis, otherwise known as black fungus, which was first identified in India earlier this year in patients who have or are recovering from Covid-19, have also been detected in the United States. According to the United States Centers for Disease Control and Prevention, isolated cases of the disease are hitting Covid-19 patients in the United States. The condition is caused by a variety of naturally occurring fungi that are typically harmless but can trigger illness in folks whose immune systems have been depleted by illness, including Covid-19. Authorities in Democratic Republic of Congo have announced the end of Ebola outbreak that began in early October in North Kivu province, claiming the lives of 6 people out of 11 confirmed cases. The authorities made the disclosure on Thursday. The Central Africa country announced its 13th outbreak of the disease in October 8 in Beni, the eastern part of the country, instigating fears of a repeat of the 2018-2020 epidemics that killed almost 2,300 people in the same region, the second highest toll recorded in the history of the disease. The Minister of State for Health, Dr. Olorunimbe Mamara, on Thursday during an interview with newsmen challenged Nigerians to take responsibility for their health as COVID-19 cases has continued to rise in the country so as to enable the country to tackle the pandemic. Mamara made the statement as the country continued to witness a sharp increase in the COVID-19 cases, where 5,398 people were confirmed positive as at December 6 and 15. Data obtained from the Nigeria Center for Disease Control on Thursday indicated a dramatic increase in infections as only 739 cases were recorded between November 26 and December 5, indicating a 630.45% increase within 10 days. And President Muhammadu Buhari has ordered an immediate release of the salaries of health workers, including salaries of doctors, that were seized during the no work, no pay policy. Minister of Labor and Employment, Dr. Chris Ngige, confirmed this development on Thursday when he fielded questions from State House correspondents in Abuja. A World Health Organization task force has been sent to South Sudan to investigate an unidentified illness, which has claimed the lives of 89 people, according to a BBC report. The country's Ministry of Health reported that an unknown disease had killed scores of people in the northern town of Fungus in Jonglei State. The WHO sent a rapid response team of scientists to the area, which is one of the worst hit by recent severe flooding, to collect samples from sick people. This is TOS Television Network. You're watching Health 54. More stories plus COVID-19 updates when we return. Welcome back. The World Health Organization has appointed Nigeria's Ayoade Alakija, a special envoy for the Access to COVID-19 Tools Accelerator, to lead the collective advocacy for ACT Accelerator, mobilizing support and resources so it can deliver against its new strategic plan and budget that was launched on October 28. She will also help ensure that the response is characterized by accountability, inclusion, and solidarity. Alakija will join former Prime Minister of Sweden, Carl Bildt, in this role. According to an Australian database analysis, women with irregular menses are 20% more likely to develop cardiovascular disease and 17% more likely to develop type 2 diabetes over 20 years compared with women with regular menstrual cycles. Links between menstrual disorders and metabolic conditions are often underappreciated and not considered when assessing cardiometabolic risk in women. Sylvia Kinkoko, a doctoral student at Monash University School of Public Health and Preventive Medicine in Victoria, Australia, and colleagues wrote, "This limits screening and prevention strategies, including lifestyle modification, and becomes even more pertinent is women's transition through menopause, which is associated with increased visceral adiposity and adverse cardiometabolic changes. The researchers wrote, moreover, premature and early menopause are associated with chronic conditions including diabetes, hypertension, heart disease, stroke, chronic obstructive pulmonary disease, asthma, arthritis, osteoporosis, breast cancer, depression, and anxiety. The Nigeria Center for Disease Control and CDC, in its routine situation report for Lassa fever outbreak in the country, disclosed that 80 people on Thursday died as a result of Lassa fever complication. According to NCDC report, 434 cases have been reported in the country. The NCDC report named the states affected by the infections to include Edo, Ondo, Taraba, Ebonyi, Bauchi, and Benue states. And the Minister of Niger Delta Affairs, Senator Godswill Akpabio, has appealed to the United Nations to consider lending the necessary support for the production of malaria vaccine to save millions of people dying from malaria-related diseases every year in Africa. The minister's appeal was conveyed when Nigeria's permanent representative to the UN, Professor Tijani Bande, paid him a courtesy visit in Abuja on Thursday. Akpabio, who explained that Africa had long been tagged as the white man's graveyard due to devastating effect of malaria disease, has been neglected for the last 50 years of medical advancement, while COVID-19 has attracted so much attention. The Nigeria Center for Disease Control, in an update posted on its Facebook page on Friday, confirmed that Nigeria registered 1,059 new cases of COVID-19 on Thursday across 10 states and the Federal Capital Territory. The NCDC did not report any new COVID-19 related deaths as of Thursday, December 17, 2021. The update by the NCDC revealed that Lagos recorded the highest number of new infections with 599 cases, followed by FCT with 238 cases, Rivers 79, Oyo 51, Ondo 32, Plateau 20, Akwa Ibom 11, Ogun 7, Bayelsa 5, Kano 5, and Kwara State 4. According to the NCDC, the 1,051 new cases of the COVID-19 infections raised the number of confirmed COVID-19 cases in the country to 221,071 cases, while the death toll from the virus stands at 2,983. It added that over 211,000 COVID-19 patients have recovered and have been discharged in the country. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.TOS TVNetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, to stay healthy. I am Rose Audu, and many thanks for watching.